I'm KP Khalsa. I'm the lead instructor and curriculum director for the Nutritional Therapy program at Portland Community College. I've been in this field for 40 years. I'm a dietitian, a nutritionist, and an herbalist. I'm currently serving as the president of the American Herbalist Guild. I've been involved in a wide variety of natural healing kinds of practices, and I have several other credentials in the field for that entire 40 years. So I deal with a lot of different kinds of areas in natural healing that allow me to bring that expertise to create a program that will be very broad in its scope, very holistic, and give people the nutritional part that will help them plug into that wider world of natural healing. This is a class for adult learners. It's a class for motivated people who are able to follow through on their own. We have 2 days per month, one intense weekend where we cover a lot of material. We have 12 topics over the course of the course. This fall term, we're going to be dealing with 3 particular areas. One of the weekends that we have in store for people during fall term is a weekend on assessment. During this program, we're going to help people understand how to determine what's going on with people in their real life, how we assess their nutritional status, their disease status, their health status in an overall way to figure out what their needs really are so we can move along with nutritional therapy. The Food Therapy Weekend is about helping people understand how to use food as actual therapy, not just helping people resolve nutritional deficiencies and things like vitamin and mineral levels, but using that will be included, but also using food as actual therapy. How do we select particular foods for particular kinds of conditions? So we'll be going through the A to Z of using therapeutic vegetables, fruits, dietary plans to really bring people to that level of optimal health that they're looking for. People at different stages of their life have different nutritional needs. In the Life Cycles Weekend, we'll be talking about how to optimize diet and food therapy for people at particular stages in their life. We'll start out with discussing pediatric populations. We'll move through middle age. We'll talk about geriatric populations. And we'll discuss all the ins and outs of those groups of people at various places in their life. Not only will we talk about people in different ages, we'll talk about different other populations of people by gender, by ethnicity, by culture, by lifestyle. We want to look at the particular individual needs of people and look for trends in terms of aspects of their lives. We also want to look at things about what these populations commonly encounter as they look to bring nutritional therapy into their life. Things about their employment, their housing, who they live with, are they living with a family, can they cook on their own, do they have transportation, how can they select food, are there income issues? So all these non-therapeutic criteria that we bring in to help understand how to help these people optimize nutritionally and still take advantage of the best health they can possibly have. Before a student enrolls in this class, it's a great idea for them to have some familiarity with natural healing concepts, some sort of an affinity for natural healing in some way, or even just a great interest in the topic. We do offer a course called Biochemical Foundations that each student has the opportunity to take if they do need some backup in that kind of area. People are going to have to take some anatomy and physiology. Many people who are going to take this class will already have taken anatomy and physiology, which is pretty straightforward and offered at a number of different places. So that can be taken any time during the course of the class or in advance. Otherwise, it's just show up and go to work. The classes during the weekend day will be very interactive. It'll be the same group of people with some people rotating in and out, but we'll have a core group of people. We'll know them very well by the end of that year. They'll know each other. They'll know their own needs, their own experiences. They'll be doing case studies. So people find that opportunity to really interact and develop their knowledge on a practical level to be very enjoyable compared to the usual just sort of lectures and taking exams. Well, the things that people enjoy about this class often actually turn out to be the most challenging. This is a class that requires people to keep up with their reading, to stay attuned to their class requirements, to our lectures, to our class discussions, and really be ready to participate in class. The great thing about this kind of structure, where you have a weekend and then a month on your own, is that it's so flexible for you to be able to to do your work as you need to do that. So people who are used to more traditional educational opportunities where they're sitting in a class 3 days a week with a lecture and they take an exam every other Friday, may find themselves challenged by the need to really stay focused on their material and make it through the material. This is a college level course. It's a career preparation course. People will be expected to perform to a high standard that will give them a credential that they can go out and then actually use in the real world. So they do have to keep up. That said, it's not onerous. People will be able to do it. We've been doing these kinds of things for a long time. We know the kinds of things that will help people through, and people will find that they'll get together in study groups, they'll connect with each other, and they'll really make nutritional therapy a part of their life. The class is oriented toward nutritional therapists who will be establishing their own practices in some way and acting as consultants, but that may be quite variable, not necessarily putting on a shingle and opening up their own office. They may work in group practices, they may work in a hospital setting, they may consult on their own, but just in the practice management area, tremendous opportunity. But that's one tiny slice for nutritional therapy. People could